Hi, my name is Harry Lee. I'm a general OBGYN in practice at the Mount Sinai West Hospital. My official title is senior attending, and I've been in practice as a general obstetrician and gynecologist at the Mount Sinai West Hospital since 1994. So the general OBGYNs see their own panel of patients in the office. And so I would see my patients, my colleagues would see their patients. In some practices, the obstetrical patients are seen by everybody in the practice. In my particular practice, we basically see our own obstetrical patients through the bulk of the pregnancy. And the main reason for that is not everybody in my particular practice is in the same location. So logistically, it can be difficult to have patients see everybody in the practice, although some practices, everybody is in the same location. So there is a rotating on-call schedule amongst the people in the practice. And in my particular practice, there's myself and 4 others. And we alternate days and nights and weekends so that the days that we're seeing patients in the office, we're not generally on call and one of the other colleagues are. That way, we don't have to cancel office hours or rearrange things in case someone's in labor at the time we have office hours. Just keeps things more consistent and allows some of us to have a little bit of time off here and there. So for our obstetrical patients, we have maternal-fetal medicine or high-risk pregnancy specialists who are available for consultation. They are also the ones who run the fetal evaluation unit, where specialized ultrasounds are done through the course of the pregnancy. And generally for more complicated cases, they collaborate with the general obstetricians in managing patients through the pregnancy. For patients who are delivering potentially prematurely or potentially have pregnancies with infants with special needs, there are neonatal specialists or basically pediatricians who specialize in newborn care. So there's a full panel of people on the labor and delivery floor. And so the person with the most direct contact with the patient during labor is the labor nurse. And the labor and delivery nurses are a very dedicated group of nurses because it's not easy work, but it's immensely gratifying, and they're very dedicated to what they do. In addition to the labor nurses, we have physician assistants on the labor floor, as well as residents who are medical doctors who are in training for the specialty of obstetrics and gynecology. And in addition to the residents, there are 2 full-time laborists who are fully trained obstetrician gynecologists who staff the labor floor 24 hours a day, who assist us in keeping an eye out on the patients and their progress, and also act as consultants on the labor floor. So decisions are often a group effort, and decisions are usually made between patients and the physicians, depending on the situation. And the decisions are based on what we call best practices. And so best practices are a set of guidelines that are published by experts in the field. And there are some checks that are on the labor floor just to make sure that decision making is appropriate. For example, when C-sections are done or decided upon, for whatever reason, they are double checked by one of the laborist attendings on the floor just to make sure that the decision making is correct and that best practice criteria are met in making the decision for a cesarean section. So decision making is, like I said, is generally a group effort, and there are checks and balances to make sure that the decision making is appropriate. There is. So midwives have their own practice and generally deliver patients, see patients, through the pregnancy and the labor course the way an obstetrician would, but specifically for low risk patients. So when midwives are delivering patients on the labor floor, they are backed by a group of physicians, just in case things go beyond the scope of the midwifery practice. Doulas play a different role. Doulas are hired by patients as labor support people to help them through the labor process, to keep them comfortable, help them be calm, and basically steer them through the labor course. Doulas often have a role with birth education prior to going into labor, and can be very helpful and supportive for patients in the labor process, which can be very stressful and scary at times, and doulas can be very helpful in getting patients through that process. Well, one of the main things that you should also look at is one, the philosophy of the hospital. And, our philosophy is basically that we try and let things progress and go as naturally as possible, within reason, as long as there's no complications or dangers in the process. And philosophically, our hospital has been like this for a very long time. The other thing to consider is the neonatal intensive care unit, and the quality and level of the neonatal intensive care unit. And at the Mount Sinai West Hospital, we do have a level 3 NICU that can handle newborns from the edge of viability at 23 weeks and moving forward. Which is very important. Nobody wants to find themselves in a position of delivering extremely early, but knowing that should that happen, the hospital has the ability to care for very extreme premature newborns is very comforting. And knowing that that is available is an important thing to have.